Hello, this is Dr. Gary Burton coming to you from beautiful sunny Florida, and today we're talking about abdominoplasty procedures. Abdominoplasty, this is an elective cosmetic procedure we do. We usually do it under general anesthesia. This operation takes about 2 hours to do. Following the operation, the patient would usually spend about 45 minutes to an hour in the recovery room before going home. During the operation, what we do, we usually make a transverse bikini incision. We make a second circumferential incision around the belly button and a third incision above. We remove the skin of the lower abdominal wall, keeping the belly button in place. We take the skin of the upper abdominal wall off the muscle layer up to the rib cage, and we expose the fascia or connective tissue over the rectus abdominis muscles and the external oblique muscles. These are the muscles of your abdominal wall. We tighten these muscles with a series of stitches from the rib cage to the belly button and then from the belly button below. And this will tighten the abdominal wall, it will flatten it, it will bring your waistline in, it will put you into a nice tight package. I like to place a drain tube in. I usually place one drain tube in, I run it along the right side of the abdominal wall and loop it over to the left. I secure this drain tube with a single stitch, and then what I will do is have the anesthesia service flex the patient at the waist about 35 degrees to bring the upper back up off the table, and then I stretch the abdominal wall skin down, creating a nice toned abdominal wall. I hand sew everything in place, bring the belly button back to the surface through a small opening in the anterior abdominal wall. And to complete the operation, I usually do a little liposuction of both lengths to give the patient a nice even contour. The main reason to undergo an abdominoplasty procedure is to improve the abdominal wall tone and overall appearance. With any operation, there are risks that can happen. Anytime you make an incision, whether it's a small incision, say for a liposuction, or a larger incision with an abdominoplasty procedure, when you break the skin, you can allow bacteria that we have on the skin to become internalized. This can lead to a localized infection or even a systemic infection. We know this can happen, so before the operation, I always give my patients a single dose of IV antibiotics before we start. I have my surgical team prep the skin with a surgical skin soap solution or betadine prep solution to decrease the bacteria count on the skin, and we always use a sterile technique. Following the operation, I will usually keep my patients on an oral antibiotic for 3 to 5 days following the operation to minimize the chance of an infection. So an infection is one complication that can potentially happen. Another complication is a seroma or a hematoma. A seroma or hematoma is just a collection of either fluid or blood in a potential space. And I know this can happen, so what I do during the operation, I'm going to place a drain tube in that space. When you undergo an operation, your body will produce usually some fluid in response to the trauma of the operation. If I'm hammering a nail, if I miss the nail and strike my thumb is going to swell, it's going to make fluid. The same thing if you're having an abdominoplasty procedure. Your body can make fluid in response to the trauma of the operation. But because we lift the skin up and put the skin back down, the fluid can build up in that potential space. So I'm going to put a drain tube in there to drain that fluid. So once your body recovers from the operation and no longer is making that extra fluid, we can safely pull the drain and minimize the chance of you forming a seroma following the operation. Well, if I have a tummy tuck today, what happens if I get pregnant in 2 to 3 years down the road? Will that affect the pregnancy, or will that affect my abdominal wall appearance? And the question is no, it should not affect your pregnancy, but yes, it can affect your overall abdominal wall appearance. Because the uterus is enlarging slowly, it's going to slowly stretch out the skin and muscle layer again, so it should not have a dramatic impact on the pregnancy. But once the pregnancy is over and you deliver, you might have some excessive skin and poor muscle tone from the pregnancy. So if you're thinking about getting pregnant, again, have all your pregnancies, enjoy motherhood, and after all your pregnancies are done, have a tummy tuck. But if you do have a tummy tuck and decide to get pregnant again, it's not going to impact your pregnancy, but yes, it might impact your overall abdominal wall appearance and skin and muscle tone. So yes, fellas, you can undergo an abdominoplasty as well. Of course, you can't get pregnant, but if you were heavier at one time in your life and lost weight through diet and exercise or a gastric bypass procedure, once you achieve your overall ideal body weight, you too can undergo an abdominoplasty procedure to restore your overall abdominal wall appearance and tone. So you see, an abdominoplasty procedure is an overall great procedure. It's very straightforward with very predictable outcomes. And this cosmetic procedure can be coupled with other operations as well. It can be coupled with liposuction in the back or a breast procedure. It can be coupled with the breast enhancement, breast reduction, or breast lift procedure. This is Dr. Burton. Thank you for sharing a part of your day with me. If there's anything else you would like to know about abdominoplasty procedures, leave a comment below. We'll see you on the next video.